G'day, I'm David A. Elliott. Today is the 15th of August 2020 and I'm going to talk about the topic of the year, the COVID-19 pandemic. Now, one thing that has annoyed me is people say this new virus is no worse than the flu. Now, I know they're talking in two areas here. One is the effects it has on you health-wise, but also in terms of the numbers and the proportion of people it makes sick and how many die. So what I thought I would do is I'd focus on the Australian data and look at what flu numbers we normally get and how many people die from it each year. And then look at this year and compare the flu numbers with the COVID numbers and how that may have affected things. So apparently last year was a particularly bad year in Australia with 313,061 cases, which resulted in almost 1,000 deaths. So looking at the data from 2014 up to the end of 2019, there would normally be on average about half that number of cases and half that number of deaths. Now, last year it did start out fairly high in the summer because we in Australia have our winter in the middle of the year and summer is at the end of the year and into the beginning of the next. So it was a very early season, and looking at the data for this year, it was starting out at a high number of flu cases. Now, these are laboratory confirmed cases, just like we're doing with the COVID-19 data. So it's not just a doctor saying, oh yeah, I think it's the flu. It is actual laboratory confirmed cases. So if we look at this year's data, then up till this point, or at least within the last few days, there has been about 21,000 cases of influenza this year that have been laboratory confirmed. And this has resulted in 36 deaths. So this is a death rate of 0.17%. Now, looking at past years, it is probably generally the death rate is double that. So I will take that into account when I look at the COVID-19 data. And similarly, in Australia, if you do look at the COVID-19 data, there is a slightly higher number of cases, 22,358, but there are 361 deaths. This is 10 times the number of deaths from influenza. So you could say the death rate is 10 times greater than influenza for this year. But as I said, if you look at the average over the last 6 years, then fair enough, we'll say the death rate's 5 times that of influenza, given the same number of cases. Okay, so now you might be saying, well, the number of cases of influenza is about the same as the flu, so it's not that much more contagious anyway. You know, more people might die, but it's just no worse than a particularly bad flu year. But we have to take into account that we have been taking measures to prevent the spread of COVID-19. And also these same measures would generally help in stopping the spread of influenza. One of the big differences though with influenza is we are not isolating people who have influenza or locking them up in quarantine just in case they do have it. You could say it is more likely to spread within the community than COVID-19. Also, with influenza, in the first 2 or 3 months of this year, we had no control measures at all for COVID-19. These didn't start to be introduced until March. And if you look at the data for influenza, you can see we were on track for a very bad year of influenza. From March, the number of reported cases of influenza drops dramatically. So for May, June and July, we were getting about 200 laboratory confirmed cases of influenza for Australia every month. Now, in Victoria, the situation was there were about 70 cases a month. The reason I mention Victoria is because in June there was a rapid increase in cases of COVID-19 and a serious outbreak in July, which has only just peaked in the last week or two. So if we look at the situation in Victoria in July, there were 70 cases of influenza and 10,238 confirmed new cases of COVID-19. So in other words, there were about 150 times more cases of COVID-19 than influenza. Even under more strict control measures, influenza was very low in comparison to COVID-19. This suggests COVID-19 is highly contagious and probably far more than that of influenza. So if we say there's 150 times more cases than influenza and the death rate is 5 times higher, you could say that we would expect 750 times the number of deaths that we would get with influenza. Now this could be a bit of an exaggeration, like these are just basically ballpark figures, not thorough scientific investigation. But say you were to get 1,000 deaths of influenza, you're talking 750,000 deaths from COVID-19, which, I think probably is slightly over the top. The predictions early in the year were somewhere of the figure of 100,000 deaths in Australia from COVID-19 if it was just left to its own devices. So we would be in a much more serious situation, I think, than just a few hundred deaths if we just let it rampage throughout the community. G'day, future David A. Elliott here, 1 week after the recording you've just seen. A problem you would have seen there is an example of trying to do calculations and analysis during your recording phase of the video. So I've done some further research and analysis. So the first thing I thought I would look at is the 2019 data for influenza in Australia. You can see it peaks in July during the middle of our winter with just over 70,000 cases that were laboratory confirmed cases of influenza. This would result in approximately 200 deaths for that month. Now, if you look at the laboratory confirmed cases of influenza during 2020, you'll see that January and February were pretty much on the same track as January and February during 2019. However, something happens in March and it starts to decline. Then after that it declines rapidly until you're getting approximately 200 cases a month from May onwards. Adding the COVID-19 data, you can see that March was when the first spike occurred in Australia. This resulted in the introduction of measures, including restrictions, that helped reduce the number of cases of COVID-19. And as a consequence, it also reduced the spread of other communicable diseases. This included influenza, and so is obviously the main cause of the reduction in numbers of influenza cases. So as an incidental consequence, this could lead to the saving of up to 1,000 lives this year with influenza alone, and that wasn't even the targeted disease. You'll see that the introduction of restrictions in March resulted in a decline in the COVID-19 case numbers. So in May, these restrictions began to be lifted, and then the cases began to rise again. And with this virus, if you start creating more opportunities for the virus to spread, then once it finds a chink in the armour where it gets out into the community, the numbers increase more rapidly and it is much harder to control. This appears to be what has happened in Victoria. So sometime in May, it leaked out into the community and began to increase in numbers during the month of June, until it got very much out of control in July, with over 10,000 cases being recorded that month in Victoria alone, and is likely to have led to about 200 deaths. This is confirmed if you consider a 2-week delay in deaths after the cases initially occur. And if you look at the deaths for influenza this year, there's only been 36 recorded deaths in Australia, with the last recorded incident being in early May this year. Consequently, it's been over 3 months since we have had a death. You could more or less say that influenza in Australia has been virtually eradicated. Though, of course, that's not strictly true. It's just very, very much reduced. Okay, I thought I'd now have a look at the number of COVID-19 cases by state, so then we could sort of have a look at where the numbers were in control in which states. Then have a look at the incidence of flu in those states for comparison. So if we look at the states, we can see that in March, New South Wales had significantly higher number of cases than any of the other states, approximately twice of Victoria's actually. Then the cases dropped and Victoria has this major spike in July. So we can see that the numbers weren't in control during March and July. About 95% of the cases in July are actually in Victoria, with New South Wales pretty much making up most of the rest of the 5%. Now, if we're looking for the best month to compare for the controlled incidence of COVID-19, then May would be the best month. So if we break that down again by the number of cases of COVID-19 and influenza, we can see most of the cases are once again in Victoria for COVID-19. So it might be helpful to eliminate Victoria when we're looking at that, because May was the month when Victoria's cases did start to get out of control. In most states, the number of cases of COVID-19 were less than 10. This would tend to indicate that the COVID-19 virus had essentially been eliminated from those states. And actually most, if not all of those cases, were people who entered those states from elsewhere. So comparing COVID-19 and influenza in controlled situations is probably not best in those states, because if it doesn't exist, there's no real comparison. That just leaves New South Wales and Western Australia. In Western Australia, the COVID-19 cases were twice the number of the influenza ones. In New South Wales, the COVID-19 cases were approximately 30% higher. Now, it is known that COVID-19 is much more contagious than influenza. This is obvious from the fact that we're not trying to control flu, but the flu numbers are still lower than the COVID-19 cases we are seeing. And the COVID-19 seems to more easily get out of control. So if we're trying to get an idea of the number of deaths that would have resulted in comparison to the flu, if we assume conservatively that it is only as contagious as the flu, then in July we would have expected 70,000 cases if we didn't try and control it based on last year's data. At a 2% death rate, which appears to be the current level, that would have resulted in 1,400 deaths, as compared to about 200 deaths for influenza. This 1,400 figure is already about 50% higher than last year's annual number of deaths from influenza. If we were to say the annual number of COVID-19 cases was 300,000, as would be similar to influenza last year, then we would expect about 6,000 deaths from COVID-19 for the year. But with such a high number of cases and the expected high volumes of hospitalisations, it would overwhelm our healthcare systems. And as we've seen in other countries around the world, when health systems are overwhelmed, this can result in a death rate up to 10 times higher. That would be 60,000 deaths for the year. But remember, I'm basing the case numbers on influenza's case numbers. With this being more contagious, you would expect the numbers to be higher. So the figure I said that I heard earlier in the year, that it could be as high as 100,000, does seem to be more realistic. Whether correct or not, the main point here that I'm making is that the flu numbers do indicate that the measures we have taken have had great effect. For example, the flu numbers in July were reduced by 300 times what they were in July last year. In a week or two, I'll upload a new video showing what Australia's number of cases and deaths would have been if we had the same situation as other countries. In other words, I'll be adjusting the population down to Australia's population size. So watch out for that video in early September, or subscribe and click on the notification bell to be advised of when I upload it or any other future video I upload. In the meantime, remember to social distance and to wear a mask. I'm David A. Elliott. Try to have a good one and see you around like a rissole.